Good morning, and thank you for joining us. This is Sunrise, and I am Alero Edu. Oh yes, I'm all on my lonesome today because my many boyfriends on this program have decided to be AWOL. Well, that's allowed from time to time, but I'm sure that in no time at all, one of them will be back to join me in presenting this program. As usual, an eventful week, but what really caught my eye was the launch of the electric car in Nigeria. The electric car. I found that very interesting indeed. In a country where you hardly have electricity, some areas don't have electricity for months, we are launching the electric car. We are launching the electric car. And guess what? It's going to cost, you know, when you write a check and you say, pay the sum of 50 million naira only. Well, this car is going to cost 24 million naira only. So my thoughts were, my imagination immediately flew to, okay, so I buy this electric car, because the governor said that they were going to have charging ports in filling stations and in other places as well. So I thought to myself, okay, so I drive my car, I'm running low on power, so I drive my car to a charging port and I plug it on. And of course, there's power failure in that port. So of course, I'm going to scream that name. You know those people. I'm not about to say their name this morning. I am not about to say their name. So that is what seems to be our problem now, getting an electric car in a country where there's no electricity. Well, we'll see how that one plays out. Now, I want to send a shout out to Mr. Oreduni of LASMA, who is making special effort in making sure that the officials that are on the road are well-mannered and well-trained. He did something on Thursday. You know, that traffic on Thursday on the island coming to the mainland, because I hear that the cause of the accident happened either around Ojuelegba or Adekunle or somewhere. Some trailer had spewed all it was carrying onto the road, and it caused horrendous traffic. And in that traffic, well, there were law enforcement, including LASMA, trying to ensure that the little movement you made was made in some kind of order. So a little incident, well, I'm not going to tell you about it today, caused me to end up at Surah in the LASMA office where I met this gentleman. And the way he handled the case was so impressive. And what he said to his staff, you know, about their training and all of that. Thank you very much. We do appreciate your efforts. Marshall at Surah, actually it's called Olowu, especially the marshal, that's the overall boss at Olowu. Thank you very much. We do appreciate the work that you're doing. And for those of you who live in Lagos, or those of us who live in Lagos, the third mainland bridge will be shut from midnight today. Shut completely, both sides shut from midnight today until tomorrow, Sunday, 6 p.m. Christmas is 4 weeks away. Normally, at this time of the year, we begin to feel Christmas. I don't know about you, but I am not feeling Christmas. Normally, by now, you'll see Christmas trees, you'll hear Christmas carols on radio. But I guess people are so stressed. And cost of living, inflation, you know, cost of fuel, everything is just going up and it's making people very, very unhappy. So they're not looking forward to Christmas because Christmas is a time where you spend. It's a time for giving. It's a time for loving. I mean, that's not to say that Christmas is the only time you give and the only time you love. You love all the time and you give all the time, but Christmas is a special season for stuff like that. And People's disposable income has been eroded into, so they may not have plenty of money to spend at Christmas. Not to mention the cost of food items. This is a time where people buy stuff, food stuff for their staff, rice, vegetable oil, and things like that. But I'm not sure many companies are going to be able to do that this year. Coronavirus took its toll. NSAS climbed on top of that and took its toll. Many businesses have gone under. Many people, the lucky ones that is, are on half pay. So what kind of Christmas are people going to have? That's a big question. I know that many people are going to have a very dreary Christmas. So in this period of Christmas, let us think about the other person. Let us think about that person who has lost his or her job. That little business person whose business actually was rolled into the ground during the coronavirus lockdowns, and then even during the NSAS, maybe his or her business was one of those that the hoodlums attacked. So let us think about them and reach out to them. No matter how little the help is that we give them, help is still help, and anything would be appreciated. That is what Christmas is all about. The season for giving, the season for showing love, the season that you spend with your family. Family, that's where it all begins. We're talking in our country about we have lost our values, we have lost our values. What are we talking about? The family seems to be breaking down. A child's first encounter with discipline comes from the home before he or she starts school, and then it's added onto it. So what is happening to parenting? What is happening to mom and dad? Are they there to guide the children aright? Why do we have so many hoodlums, as they say? Why do we have so many children who have no respect for elders, who don't seem to know right from wrong? This is a time for us to begin to think about all that and begin to set our path straight again. So much for my chat this morning. The menu. Today we'll be looking at the increase in COVID-19 caseload. Wow. You know, we were worried about a second wave. Well, maybe this is the beginning of the second wave. Well, we'll be talking about that in today's program. And then a big one, solving the Lagos Transport Challenge. Solving the Lagos Transport Challenge. That seems to have defied any kind of solution, but we'll look at that this morning. I'm sure that in light of what happened immediately after NSAS, Lagos State has put together some things to, at least in the short term, deal with what happened. Farm for All project. Well, they say we should all have little farms in the back of our houses, planting vegetables and little fruits and all that. We'll look at that and what is happening with that particular project, which is put together by some foundation. And then, as is usual, we shall close with the Artist of the Week segment. And all I can tell you is that he is a he, and a very interesting he. He was born in Nigeria, he grew up in the UK, and he ended up in Australia. Wow. Talk of an international man. But he is a Nigerian. So stay with us, and we'll talk about all this in the course of today's program. Thank you for staying with us. Now let's get the show started. On Thursday, the Nigeria Center for Disease Control, NCDC, recorded 2 coronavirus deaths. The first time in 6 days that the country recorded fatalities from the disease. While everywhere is almost open now, as in shops are open, schools are open, churches are open, activities are gaining momentum, What does this portend? Does this mean that a second wave of the virus is coming? Are we heading for another lockdown? But they tell us that a lockdown is not good for our economy, but we are not obeying the coronavirus COVID-19 protocols. This country has been hit hard, and the result is that our caseload is getting higher. The last time any death was recorded from the virus was Friday last week, when one patient died. The 2 additional deaths on Thursday brought Nigeria's total fatality toll to 1,165. Now, to look at this increase in caseload with us this morning, it's my pleasure to welcome Dr. Alero Roberts. Well, there are 2 Aleros out here this morning. Dr. Roberts is a consultant public health physician. Good morning, Alero.
Good morning, Auntie. How are you?
I'm nice good, to be here with you.
I haven't seen you in ages.
I'm well. Thank you. Well, I'd also like to welcome Dr. Abby Abraham, who is a public health physician. Good morning, Dr. Abraham.
Good morning. It's very nice to be here this morning.
Thank you very much. And we shall also be joined by Dr. Oyeladun Okunromade, who is Head International Health Regulations, NCDC, and she will be joining us from our Abuja studios in just a moment. But in the meantime, we've got the 2 other doctors with us. Dr. Roberts, what would you say is responsible for this sudden spike?
To be honest, it's actually not sudden. It's something that we knew was coming. It's something that has been there. And unfortunately, what's happening is that as people are becoming more sick, they then present in the health facilities. Schools being back also has added to the numbers because we know that it has been spreading in schools. They get infected. The children do not get sick because they're younger, but they do take the infection back home to vulnerable parents and grandparents. And that's part of the reason why we're seeing what we're seeing.
Dr. Abraham, when schools reopened, there were fears that they shouldn't have been reopened when they did. And as soon as they reopened, we heard of some numbers. And I think I recall that one school recorded 200 pupils who had been infected. Do you think that something should have been done about schools reopening, maybe more virtual schooling for the children?
We are really in uncharted waters. And in the end, hindsight is always 2020. Lots of public health physicians and lots of researchers always work on paradigms and things like that. I don't think it is something that is very straightforward like that. Because if we had not reopened, if the schools had not reopened, it was a balance. There would have been other issues that would have come up with regards, their schooling, with regards the examinations, and with regards other things. There were also lots of cases of violence happening in the house. There were psychosocial, psychoeconomic factors and things like that. So I do not think it is a straightforward answer, really. I think in the end, we are going to always have to rely on facts and figures, but also we have to rely on the fact that we have to keep safe. We have to make sure that we follow all the infection control procedures. It is very difficult to tell whether if we had not why there were 200 cases at that point in time. It could just have been something small that happened. So what I would say is that instead of what we can do perhaps to avoid this is to continue to follow the infection control procedures and continue to take them even more seriously. I think we can get to a stage where we start to lower the cases of COVID just by following the prevention procedures.
Dr. Roberts, Dr. Abbey has spoken about us following the protocol, but I'm sure you have noticed that not many people even believe that this virus exists. And for that reason, people are not following those protocols. You see a lot of people on the streets without masks. And I suspect that it is now a crime not to wear your mask when you're outside your house? Please correct me if I'm wrong.
Well, apparently it had been gazetted that that you will be penalized if you didn't wear a mask outside. But I must confess, it's very difficult to be obedient to an administration that themselves are not being obedient. Because people look at what others are doing and they feel, why should they be obedient and sacrifice and suffer the inconveniences for themselves when those who are clearly supposed to be in charge are not doing likewise? I mean, we all know what has happened in Nigeria in the recent past, and it's still going on. We have been driven underground, and that's going to make it worse. So telling people to wear a mask outside, they're going about, they're trying to just get something to eat, something to keep body and soul together, make ends meet, trying to get children to school, trying to keep their jobs, trying to get a job, because many of people have lost jobs. And then you're starting to inconvenience them with this mask wearing, which in itself has a financial implication to a great many Nigerians. It's just not going to work. First of all, they need to see this discipline and determination from everybody in the administration, not just the NCDC, not just the healthcare workers. How do you wear a mask when you're busy trying to get into a bus? Maybe that's the only bus going to your area. Then they tell you that, 60% occupancy and it's full and you can't go. It's 6:45. It's 8 o'clock at night. You need to get home. So it's very, very difficult in a society that has, a society living under an administration that has not themselves been obedient, for us to now get the people to be obedient. I mean, I know one of the top guy in NCDC who confessed openly to us in public that they made a big mistake in that they should have gotten consensus from the grassroots and worked upwards with the community. You've got to work with community engagement. How do people believe that there's COVID or COVID is real? Like everybody still says, tell me the name of somebody that has died of COVID. And if COVID is the big bad thing that they are saying that has come from the US, then it's only the people that go to the US, UK, and Europe that are going to get it. They have no problem. They need to just make a living, get a job, make ends meet, feed the children, try and pay school fees, try and meet up with the rent.
Okay, Dr. Roberts, sorry, we'll come back after this break and continue the conversation, and you can take it from where you just left off. Welcome back, and thank you for staying with us. We've since been joined by Dr. Oyeladun Okunromade, who is Head International Health Relations, NCDC, and she's joining us from our studio in Abuja. Good morning. Dr. Okunromade, can you hear me? Well, we seem to have an issue with her, but I wanted to ask her a question that affected NCDC directly, but I'll take it to Dr. Abraham. At the crux of the matter of this coronavirus is each country's ability to test and have accurate figures regarding those infected and those dying. Many have said that our figures are not accurate because we haven't been able to test enough. For instance, of approximately 200 million of us, only about 750,000 have been tested. What are your thoughts about our testing capacity?
Well, the testing capacity could really be improved. I do know that NCDC have done a lot of things to make sure that they test as much as they can. But think about it. You have given a correct figure. What is the percentage of that, the numbers that are being tested? But I think we need to backtrack a little bit, even from the NCDC. And in a sense, key into what Dr. Alero said with regards the grassroots and informing the grassroots and proper mass communication services that would even inform people as to what exactly is happening. I'll give you a quick example now. Somebody came from abroad and they went to one of the southeastern states and they were wearing their masks and they asked everybody at the airport, do you know about COVID? Do you know about COVID? Why are you not wearing the mask? And what did they say? They said, what is COVID? They didn't even know there was anything like COVID. And so, even if there was the facility to test, which I think the NCDC is really trying to increase. They keep increasing their capacity. They keep increasing their labs. What about the communication? What about the engagement with the grassroots? What about the focus groups? You know, just that service that actually goes to where the population is. That is, especially in the rural areas, and says, this is what is happening. You know what? Where are the shows, the road shows? I think we really have a big issue. We are not testing enough. And so I suggest that we really have to increase our capacity, not only for the labs, but for also actually educating people, you know, informing them, enlightening them, and then doing what you want them to do. It's no point saying people should wear masks or people should test if you yourself are not getting tested or if it is not being demonstrated. So we really need to do more, especially in the enlightening aspect. There was a time when NCDC, there was a law where they were asking people to come and test. There was capacity to test, but there were not people who were being tested. And so those are things we need to examine very, very closely and wonder exactly what is going on. My suggestion is that we do need to have proper mass communication, proper advertising services, people who have insight, who can go into the grassroots, who can really go and really spread this, because I do not suspect COVID is going anywhere very soon. Thank you.
Dr. Abraham, I'm surprised when you say that many don't even know that this virus exists. Because at the time of the lockdown, there was plenty of communication going out about it and why the country was the entire country was in complete lockdown. Some of them just knew that there was a disease, because I saw a video of a little girl who, when they asked her, so why are you not in school? What do they say is wrong that everybody is at home? And she says, they say there's one disease called coronavirus. Well, at least she had an idea that there was some disease that made her stay at home. So I'm surprised you say that. I mean, it's one thing to know about it. It's another thing not to believe that it exists.
And it is yet another thing not, as you say, it's yet another thing not to even know that it exists. And if you even look at the number of users we have, of people who use television, people who use videos, people who use phones, there's deep penetration, but it is not deep enough yet. There are, you know, pockets of people in the real rural areas who still do not know what is happening. And those are really the people I think we need to start targeting now if we want a robust group of people who we are going to test.
Let me welcome once again Dr. Oyeladun Okunromade, who is Head International Health Regulations, NCDC. Good morning, Doctor.
Morning. Thanks for having me on your program.
Good to have you with us. Now, we were talking about testing and how many, the numbers that we have tested in Nigeria compared to the population of the country. And we recall that your agency did say that we had enough testing capacity in collaboration with the state governments, you know, to take care of our requirements. Can you please tell us more about that?
Okay, so to shed more light into the testing, actually, in Nigeria at NCDC, we set a target of testing 1% of Nigerian population at the beginning of this response. And I would say that currently we are not near that target at all. We're just close to testing about 40% of the target at the national, looking at the national figure. Currently, in terms of testing, now we test about 30,000 tests per week. Gives us about 3,000 to 5,000 tests that is being conducted daily across the country. But that's to look at the national figure. But if we go to the state-specific figure, we'll see that some states actually, they have actually met the target and even surpassed the target. States like FCT, states like Lagos State, Rivers, they're doing the most in ensuring that the number of the population that are being tested are actually up to the target and even more than the target. But we are a federal system. We cannot base our our sources on the state-specific data. So at the national end, we say that we're not near the target. Most of the states are not really driving this process. They're not doing the most. At the national end, we keep encouraging the states because there is little to what we can drive at the national. We continue to work with the states to drive our policies. And we keep engaging the states to ensure that they keep reinforcing and ensure that people come out for sample collections and increase sample collections. We've worked with the states to ensure that we have sample collections located across all the LGA in the country. This is to ensure that we capture all the communities across the country. And also, we've also at NCDC worked with the states to build their capacity in terms of testing laboratory capacity across the state. Now, currently in Nigeria, we started with no capacity for COVID-19 lab to one. Now we're boast of over 100 laboratory COVID-19 laboratory capacity across the country, with every state having at least one lab to test COVID-19. But as much as we can do, we need people to come out for tests. We need people to see the need to ensure that they come out for tests, and this is where the risk communication comes in. We engage with the state as well as all the media, partner with the media to ensure that we keep reinforcing the information and the need to increase our testing, to increase our tests across the country. And just like was mentioned, the most important thing to note is that despite the fact that the COVID has been with us for a while, there is this still mistrust or misbelief and misinformation within the communities. So we're working hard to engage more with the grassroots and ensure that we keep reinforcing the information over and over again. That's the only thing we can do. We won't get tired. We keep reinforcing the information and the need to increase our sample collections across different states.
Now, you talked about the grassroots. The local government is the government that is that reaches the grassroots. So what is the role of the local government in all of this?
For us at NCDC, we work directly with the state government, and at the state level, the state work directly with the local government level. So it's a form of a network. We network with the state, and the state network with the LGA. And the local government are the one in charge of the communities. They're the one in charge of the grassroots. We work indirectly with them. We build their capacities in terms of their risk communication. Aside the LGA, in each LGA, we have what we call the LGA Health Educators, and also we have the LGA NOA, the National Orientation Agencies, that we use to pass this information and disseminate this information across to the communities. And they are the one that actually involved in passing the information across, as well as disseminating the information to the people and making them see the need to come out for testing. And also we're using them as a form of a kind of a surveillance agent to ensure that they sensitize the community on signs and symptoms to look out for and the need to report if there is any. So the LGA are actively involved in this. We work directly with them through the state, as well as build their capacity at every level.
That you are getting, are they performing this role creditably? Are you happy with their performance in performing this role?
Yes, there is a forum where we interact, and also where they send the information on the activities that they are engaged in, and it's a kind of a feedback and a forward kind of a channel, and they are performing the role. We're happy with the role they're performing, and if we keep reviewing the process as well and keep giving them more information on how to go about the engagement, as well as building their capacity in terms of reviewing of strategies, or if there is any need to add more information. And we're working collaboratively with them, and we all have a forum where we interact, and they pass the message across to us.
Okay. Now, Dr. Roberts, looking at the figures from this week, are we heading for another lockdown?
What will not happen, because the impact on the economy we really can't face, and we will not gain anything from it. I think, I truly like what Dr. Kumar said from the NCDC, because I find that they've been completely realistic about the challenges that they're facing and the challenges we're all facing as a result of this. And I dare suggest that, in view of the fact that we will see more numbers, you will recall, sis, that I keep saying this thing, and it's actually true. We're all going to have to come in contact with this virus, one way or another. We are hoping the one way will be via the vaccine, which is a controlled, safe, effective way of coming in contact with the virus and building your antibodies and your immunity. However, there is still the risk and the danger of coming in contact with it the other way, getting sick, getting very sick, and then not being able to beat it. So we cannot convince people to come out for the test, because it's very simple. They do the test, they turn negative, they isolate for 14 days. What if you're a daily paid worker? You can't do that. And we're not in a position as a government, as a society, to support you to stay at home for 14 days if you should test positive. So there's very, very, very little incentive to come out and test positive, particularly also because a great majority of people are developing the infection and remaining asymptomatic, or at worst, mildly symptomatic. I think one of the things we really need to start paying attention to is updating and upgrading our health system to actually cope, because people will only come forward when they get sick. So what we want is a case where, when people develop their so-called malaria, because this virus presents very similar to malaria with AIDS syndrome, when they get this so-called malaria, they have a trusted place they can go where they can be monitored. And if they do get severely ill and require respiratory support, which is the thing that's going to take you out, they will be able to get it. But, trying to get people to come out for a test, no matter how beautiful your testing centers are, no matter even if you can get the result fast, there's no incentive, because once a person turns positive, the only treatment you can offer is this isolation for 14 days, which, if they are asymptomatic, they are not going to actually, because they're too poor. We are actually too poor to be able to do that. So we are going to get an increase in numbers, there's no doubt, but we need to continue strengthening our health system. So far, we've been very, very blessed in being able to flatten the curve a great deal. But we need to not rest on our own. So I think government needs to listen to NCDC a little bit more closely.
Yeah, so how do we prevent, with the figures now rising, even though you spoke about flattening the curve, the figures last week don't speak of flattening the curve, because the figures spiked. And for the first time in a long time, we actually had 2 deaths in one day. So what do we need to do to ensure that we don't arrive at the point where there is another lockdown?
Well, the funniest thing
you
is
have
that
said it's not desirable,
Yes.
but we're going towards it.
About obedience? Remember what I said about obedience and the administration not being obedient? You were not just now on channels transmitting the Kaduna Marathon. Did you see any of the public health interventions being taken seriously? Maybe only about 50-60% of the crowd were wearing masks. They were all packed closely together. You are running a marathon in a state. That means that it has some political commitment, some political will. And you can't even manage to do that and keep the public health interventions in place. Of course, nobody is going to believe anything we say after that. So these are the issues. We have to keep the public health intervention. Wear a mask when you're outdoors. If you can't stay away from crowded places, then please wear a mask. As much as possible, don't get into a crowded place. Wash your hands with soap and water for 20 seconds. 20 seconds, not just a quick, dash under the water. And if you can't wash your hands, please use a sanitizer. These are the things that are working everywhere where they have managed to quell this virus. Look at Southeast Asia, Korea particularly. You will see that all they are doing is being obedient to the public health interventions. But that obedience must come from the top.
Dr. Abraham, at the heart of this as well seems to be the issue of awareness. The people are aware, but for some reason, they don't seem to believe that this thing exists. And this is the reason why they have refused to wear their masks. They have probably refused to carry their sanitizers. I mean, the mask one is pretty obvious, even though wearing of masks, at least in Lagos State, has been gazetted. So what can be done to skew the awareness being given, to convince the people that this thing does exist, and figures do show that some people have died from it?
Mm-hmm. Thanks for that. That's an excellent question. It's something that we have given great thought to. And one of the thoughts that I have personally is, Africa, Nigeria, we're still by and large quite a patriarchal type system. There's a father somewhere, there's somebody that we trust. The issue is trust. Now, I should also suggest that our places of worship, the mosques, the church, all the other centers of worship be brought into this equation right now. And actually, just like was said about the NCDC, how the national orientation agencies are actually working with the NCDC to spread awareness, we should bring these people on board now. These are the church leaders, the mosque leaders, and the charities. Now, I'll give an example. There are some charities, NGOs, who do palliatives. And I have witnessed where these NGOs will bring the people to collect the palliatives, and they will make them wait and watch a 5-minute video. And after, how to wash their hands and stuff like that. And after that, they will then give them a talk while they are giving them their palliative. It has a hugely psychological impact. That this is the person who is feeding me, and this person is telling me that this thing is right. We need to go into the psyche of the people now. It is very delicate. You will not listen to somebody you don't trust.
Exactly.
But if we engage these people, this huge group of people who are actually, instructing most of our population, I think that would also work. We have charities, NGOs, churches, mosques, all these people, and lots of other organizations who are working on the side. And I think they have to be brought as stakeholders on the table now and actually said, spoken to us and look, how can you help us to disseminate this? Now, these people are in the grassroots.
Dr. Abraham.
Also. You have the chiefs, you have the men of peace.
Dr. Abraham.
Yes.
I do apologize. We need to take a short break, and then we'll come back to you when we return from the break. Thank you for staying with us. Dr. Abraham, you were talking about creating more awareness so that the spread of this virus can be curbed.
Yes, I was talking about thank you for that. We call them mighty men now, but they used to be called hoodlums and thugs. They actually have a code of loyalty, a code of honor. They have their chiefs. Those are the people we need to start engaging now. They are the people we need to sit with and say, look, this is what is happening. How can we access your community? And they are the most. There's so many of them all over the country. So I believe that if we actually engage at this level and we come to these levels where we speak to them, we interact with them, and we gather them together, we don't need the masses. We only need their chiefs. So we get the chiefs together and we ask them, how can we communicate this better? They will tell us They would tell the government what to do because they know their people and their people trust them. I believe that we have to actually get to that level before we can begin to see any form of success. They would also tell you their problems because, like Dr. Roberts rightly said, COVID is not really their problem, let's be frank. They would tell you their problems. And I believe this can be a step towards even community transformation and even the national transformation we're looking for. We don't always have to throw money at everything. It's not always about money. Sometimes it's about care. Do you actually care for these people? Do you love them? Do you care for them? Even when they see that care, they would start to respond. So this is my thought, that we need to engage the community chiefs and the religious bodies and also the charities even more closely than we are right now. Thank you for that.
Dr. Kuromade, earlier, Dr. Roberts spoke about wearing of masks and how far it would go in helping us from getting infected and us from infecting others, but said that many were not wearing masks, maybe because of the financial implication. I mean, I don't know how expensive a mask could be that it would prevent a citizen from buying it to save his own life. But all these palliatives, you know, the word palliative has been flying around since coronavirus came. Could masks not be part of the palliatives being given to the people?
Okay, thank you for that question. It's important for us to know that as part of our campaign is to ensure that all Nigerians take responsibility for themselves to stay safe and also to keep safe. And by so doing, it's compulsory to wear face mask, especially in public places, and also to avoid mass gathering. But in terms of availability of face mask, that is why we have developed guideline on the use of cloth face mask, because not everybody will be able to afford the disposable face mask and be able to renew and change that. And so there is a guideline on the cloth face mask that can be sewn by a side tailor or just by using any fabric. And this is where the recommendations on how to go about designing this, it's available on all our media. And getting any fabric or getting any tailor to make that, it's quite cheap. And it's something that every average Nigerian would be able to do. But aside that, there are so many organizations, so many NGOs and partners as well that while giving out palliatives, they also distribute face masks to the masses. And also we have even a lot of religious houses that also give that to the community. They don't just give it to their members alone, they go as far as distributing this to the communities. And even we have some core members that are producing face masks and they're distributing it and making changes in the communities where they are serving. So there are a lot of opportunities like this for all Nigerians to have access to a facial mask, be it the clothing one or be it the disposable one, as far as they can afford it. So there's so many avenues to have that available. From our own hand, in terms of NCDC, we have a lot of healthcare workers that we provide this for as PPEs. And we support state, we support LGA, or on a monthly basis. And so it will be difficult for us to put that responsibility on ourselves and add it to ensure that we distribute this to the masses. But we have a lot of organizations, we have a lot of partners that have taken that up, and they're taking that as their own corporate social responsibilities, and they're making that available to the public.
Dr. Roberts, what are your thoughts about distribution of masks?
I think Dr. Kumade has said it very, very well. There is absolutely no reason why anybody should be out in public. Very worst. I wish I had my little cloth, bandana that you can wear across your nose and mouth. Being mask up Lagos is a thing and is now being written into the Gazette. We just need to bear it in mind. And the importance of wearing a mask is that it stops you actually touching your face all the time. You are now conscious. It makes you conscious of your nearness to others. It makes you conscious of the need to keep your hands clean and sanitized and not touch too many high touch areas. So it's more than just the wearing of a mask, in my opinion. It's also become a cultural mindset that makes you aware of where you are, what you're doing, and whether you really need to be in such a crowded place for such a long length of time.
But if there is now a law that says that we have to wear masks, surely it has to be enforced.
That issue of law enforcement, I mean, you all know what we went through, and hearing some of the numbers that were coming out, who's going to do the enforcement? Here's where we are relying on change in human behavior. And like NCDC is always saying, and I quote them, you don't have to be a statistic. You just don't have to be a statistic until there's a vaccine widely available and one is willing to take it. There are other very simple measures that you can do. One of them is just wear a mask. Just not that hard. It's not rocket science.
Okay, now there's talk about a vaccine coming out soon, Dr. Okunramade. How soon do we expect this vaccine to get to us?
Say it a little bit of ray of hope for globally as well as the Nigerian community. It's a kind of an exciting news to hear that the pandemic of over 11 months, we're having access to vaccine very soon. As part of the other part of the world, Nigeria has gone ahead as well to establish and inaugurate a national task force on COVID vaccine. This is being led by the National Primary Care and Development Agencies, NPACDA, their sister agency. They work with other multi-agencies to ensure that we prepare for this vaccine. We're putting up application for it, and we're working out logistics as well as the delivery pathway for the country. And for the coalition of on this vaccine, which is the pathway through which we are going to get access to the vaccine in the country, the coalition is called COVAX. It's put together by WHO, CEPI, Gavi, and a whole lot of international organizations. They've assured us that we're going to have access to vaccine that will be adequate enough for 20% of Nigerian populations. Of course, we're going to prioritize this based on the healthcare workers that have been on the front line of COVID response since the beginning of this outbreak. And also, we're going to look at the hotspot LGA and some silent LGA. Currently, we're conducting a risk assessment across some LGA in the country. And the data that we're going to generate from this, we're going to use it to prioritize for this vaccine administration. So hopefully in the country, in the first quarter of 2021, we've been promised that we should have about 12 to 15 million doses of COVID vaccine in the country. And that is some kind of a great news for us. Thank you.
That is not very exciting news, is it? For 200 million people, first quarter of 2021, 20% of Nigeria's population.
Okay, that's to say, that's for a start off. With time, as more vaccines are available globally, we should know that this is a global pandemic, and they're going to even prioritize countries based on their burden. And if we look at the data from Nigeria and even from Africa, actually, we're not near the global priority at all. So the news of getting, having access to 20% of this vaccine for our population it's actually some kind of a respite for us. But with that's for the initial start of. With time, as more vaccines are made available, we would have opportunity to request for more and also have access to more vaccine in the country. But for now, I think 20% is kind of a good news.
Okay. All right then. Now, in parentheses, what has happened regarding research going on within Nigeria concerning a vaccine? Dr. Okonomade, what is happening
pardon?
regarding a local vaccine?
Oh, okay. In terms of COVID vaccine,
With vaccine.
we don't have that capacity yet. Looking at these two vaccines that have been announced, the technology is a kind of a new technology in terms of the storage and the administration and even to work out the logistics in terms of storing the cold chain and all the mechanisms. It's a lot of logistic kind of system that we need to put in place. So looking at doing a local research at the moment, maybe in the near future, as we have more data to back the process, as well as more evidences are available on COVID-19. But at the moment, the vaccines that are available is not something our logistics system in terms of the cold chain maintenance can actually maintain and take up as a local production at this moment. But as time goes on, we'll have more data to provide for that research purpose and see if there is an opportunity for us to take up the process. But for the local vaccines, we have other local vaccines that we're actually involved with. We're part of the Lassa fever research consortium group for vaccine, and is currently running. And we're also involved in other research with working with the agencies that are involved with this process. But for COVID vaccine, not at the moment.
Okay, Dr. Abraham, Festus Akimboyewa says Nigeria has been lucky so far in that COVID-19 cases have not soared as predicted. But another lockdown is inevitable to break the cycle of current increase in COVID-19 cases before it overwhelms our fragile health system. What are your thoughts about that? Because when this pandemic started, it was believed that it would just overwhelm Africa. But people are not dropping dead on the streets as was predicted.
Yes, I think there are many factors, some of which we are not even aware of. I mean, again, I must congratulate the NCDC for their quick at the beginning. The labs, the proactive way they started to work, setting up labs, task forces, and all that. And I believe that the index case was quickly isolated, and immediately lots of policies were disseminated. So that is one. The government was aware. The second thing I feel is that there are many theories as to why we have such a low case rate. Like we have all said today, it's not necessarily because we are strictly following any magical protocols or procedures, but there are many theories with regards to the sunshine, the vitamin D, some of the antibodies that we have. I think the latest theory is that we have lots of Africans, or should I say, in the sub-Saharan. This issue is actually this thing happening in the sub-Saharan region of Africa. So there is a theory about we have mild antibodies to some of the milder SARS viruses and things like that. So I'm not sure anybody really knows why our case fatality ratio is lower than in most other countries. But like I said, there's lots of thoughts around it, and there's a lot of research that is going on. Some people say because we have a younger population. I'm not so sure about that myself. I'm not sure about that. Because in those countries, like we know, lots of the younger ones were also seriously affected by the COVID. So it might have to do with the sunshine, the vitamin D, the antibodies we have, and things like that. So I think the jury is still out, but perhaps we could be enlightened further by the other doctors here. But I suspect the jury is still out as to why it is so low for us.
Whatever the reason is, Dr. Abraham, we say thank God for that. Dr. Roberts, do you have any theories?
Thank God. Absolutely.
No, none that have been proven scientifically. I think age is certainly a factor. Immunity, one's immune status is a factor. Vitamin D, sunshine is a factor, because these are all things that have been as prognostic factors of how a person may or may not react to the infection. But the jury is still out, as Dr. Abraham said. The science still has to be proven. All the hypotheses need to be proven to be theories before we come out on that. And it still does not negate the fact that this is COVID. Probably has a predilection for older age and people with underlying conditions. What about the next one? Believe you me, that is coming. This issue of human behavior change needs to be taken more seriously.
Yeah, Dr. Roberts, staying with you, when the pandemic started earlier this year, we spoke about our fragile health sector, and we were all locked in. I mean, nobody could go out, nobody could come in. So even those who could afford to travel out to have their little headaches treated in Germany or wherever couldn't go out. And we thought that that was a wake-up call for Nigeria to begin to sort out its health sector. Have you seen any signs of anything being done to improve that sector?
It's a difficult one to answer, because there has been a lot of commitment to health system strengthening, and not just on account of COVID. I mean, there has been a lot of commitment and words spoken towards health system strengthening, but some of the key issues are going to remain recruitment, remuneration, and retention of human resources for health. Sadly, a word to the authorities: merely buying equipment does not a health system make. You need the people. We need the scientists. We need all the cadres of health workers, biomedical engineers. We need them. If we don't have the human resources for health, both the curative, clinical, and ancillary, we can buy as many pieces of equipment that we want to buy, and white ribbon as many new facilities as we want to renovate. We need the human resources for health, and that's where the commitment has been, unfortunately, earworms.
Okay, we'll come back and continue this conversation after this break. Thank you for staying with us. Let me take this question to Dr. Okunramade. In the light of these rising figures, do you think that more stringent measures should be introduced? And if so, what should these measures be?
I would say that for COVID response so far, we have not done badly, and there is really no fear of second spike or second phase of any outbreak in sight currently. And in terms of reviving and also putting up a stringent other measures, I think for the measures that have been put in place so far, I don't think we have done badly in that regard as well. At the beginning of this outbreak, we acted promptly by ensuring that we close our borders. which was done timely, because if we are delayed, maybe we will have witnessed a surge in cases. And also, we also went ahead to close the intra-state movement. I think those measures are acted, they are conducted promptly enough, and they were adhered to some extent. And also, we looked at the available data with us at the national, and advise, we use that to advise PTF to ensure phase out of lockdown, as well as the phase out opening of the economy. So I don't think we need a any other stringent measures aside this, and I don't see us moving towards any phase of another lockdown, because looking at the statistics, the data coming in from different states, well, in the last 24 hours, we witnessed about 143 new cases of COVID. And looking at the figure for the past 2 months, because we usually use data to inform, to review our response and activities. For the past 2 months, we've been experiencing about 150 to 200 cases, with a little increase or decrease here and there. And some states, actually maybe like Lagos, that are having spikes, we keep following up and keep monitoring closely. So in terms of the measures taken so far, I think we've done fairly well. We've opened up aviation. We've opened up safe reopening of schools. We've opened up tourism. We've opened up other businesses. And recently, we just opened up NYC camp orientation. And while doing all this phase out opening up of economy, we have not experienced any major spike in the number of cases. So I think the measures taken so far have been appropriate enough.
Okay. Dr. Abraham, would you say that people are getting coronavirus weary? That's why they seem to be ignoring those protocols these days.
I think it has been with us for a little while. So there's a big possibility that is happening, especially as lots of other events have overtaken coronavirus at the time when we had a bit of a lull. But I don't, apart from the weariness, it's not, I think my thought is that we should start to also educate people and let them know that this is going to be with us for a little while longer. We're not just going to come out of it at Christmas and get a Christmas present of a corona-free, 2021, even though I really hope that will happen and pray. But I think we have to be very proactive, to strengthen our systems even more. There's one word I've heard us saying over and over again, and that is responsibility. I think we need to move now from the phase of we are telling you to do this to the phase of start to take responsibility for your actions. So, you can take a horse to the water, as they say, but you cannot force it to drink. And I think sometimes we want to force our horses to drink water. But we need to get to a stage where we need to explain to the person and the people that, look, this is for your own good. As you are protecting yourself, you're also protecting myself too. We're all protecting ourselves. So even with the mask issue, no matter how many masks you give a person, if they still feel that mask is going to give them asthma and kill them, they're not going to use it. Because a lot of people also have this thought about masks and the fact that the masks are bad for them. So it is more about people strengthening the system and taking collective responsibility for the matter at hand. Explaining that the mask is protective and not lethal. Explaining that washing your hand will help you not just with COVID, but will help you with several other diseases. So we have to, in a sense, integrate COVID into the other problems that we have in this nation. we still have lots of infectious conditions. We still have cholera and all the other gastroenteritis and other conditions like that, meningitis. We're getting to December now and stuff like that. So even another way we could look at it is explaining to people that the more you cleanse yourself, the more you wear your mask, the more you are preventing yourself, not just from COVID, but from other conditions. So we cannot get COVID weary because we're not meningitis weary, we're not gastroenteritis weary, we're not worried because they are still there. So I think we need to integrate COVID in a sense into what we are doing right now, into the whole public health sphere. That's my thought.
Okay, coming to you, Dr. Okuromade. We have, like Dr. Abi said, we have cholera, we have COVID-19, we have Lassa fever, and recently, yellow fever seems to have joined the fray. And we've had 1 or 2 deaths from yellow fever in the southeast and south-south. I mean, that was something we thought we had got over. And yet, we're here again. So what is NCDC saying and doing about this?
Okay, thank you for that question. At NCDC, year in, year out, we don't really have a break. It's been like from one outbreak to another outbreak, and it's our mandate. We have to ensure and protect the health of all Nigerians. So in the midst of COVID-19 response activities, we have to deal with surge of yellow fever recently, just now, and cholera is there. Lassa fever is coming up, also the CSM. At NCDC, once the surveillance system has picked this as an outbreak, we have gone ahead to also establish and inaugurate an EOC, Emergency Operations Center for Yellow Fever, which is currently operating in NCDC, and we shouldn't forget that we still have our EOC for COVID-19 that is going on at the same time. So we keep responding. We've established this EOC across different pillars, and we've also sent out the rapid response team to support the affected states in responding to this outbreak. And we have also issued out different public health advisories as well as the guidelines. And also we continue to engage the public on the risk communication, sensitization, information awareness, and also we keep engaging the media to ensure that the public health communication and we disseminate the appropriate information to the public on this on different preventive measures. But for yellow fever, one important thing is we're working closely also with sister agency, NPACDA, to conduct accelerated mass vaccination campaign in the affected communities, and that is what the next phase we're planning now, and it will be conducted soon. So we keep responding to any form of outbreaks, any challenges that it keeps cropping up, and year in, year out, that is our calling. That is how we are. We're always on the road to support the state, to support the affected LGA, and also to ensure that we build capacity at the state level to be able to respond to any smaller outbreaks within their home community.
Dr. Roberts, would you say that NCDC as well as the Ministry of Health are both doing enough to curb the spread of these infectious diseases?
To be frank and honest, being a teacher, I'll always say there's room for it. Equally give credit where credit is due. NCDC has done an amazing job rising up to the situation, given the constraints of resources. Government has tried to deploy as much as it can to the situation, but we are still playing catch up. This is a new virus and it picked us in a very vulnerable place. Our health system is not as strong as it should have or could have been, considering that we've been independent for 60 years. And we had a far more robust health system in the 80s and early 90s than we do today. And to try and turn that around, I mean, COVID has given an amazing opportunity for the resources that have been deployed to the health system, but it's still a catch-up game. I mean, I can only tell them, Dr. Kromade, you and your team, led by Dr. Chikwe, very dear friend of mine, are doing an amazing job given the challenges that I know you face, that you have faced from the past and probably still facing. There is still a lot of room for improvement, and this goes to the federal government. Like I said, no number of health facilities, no number of pieces of equipment are going to save Nigerian lives if you don't have Nigerian human resources for health in the right place, recruited and remunerated and retained.
Okay, so let's just spend the rest of our time together looking at how we can prevent ourselves from getting infected. What are the things that we need to be doing to ensure that we do not catch this coronavirus? Let me start with Dr. Abraham.
I think we're going to say that is going to still be our infection prevention protocols. Wear your mask. When I wear my mask and you wear your mask, we protect ourselves up to 90-something%. Wash your hands, 20 seconds to 40 seconds thoroughly. And then if you cannot wash your hands, wear a hand sanitizer. Just in case you do not have a mask, make sure that you stay at least 2 meters, that is your 2 wide feet, away from somebody else. If you don't have a mask, make sure you are usually outdoors because the concentration of the virus is much lower outdoors. And when you're going to school, you also make sure that you take your hand sanitizer with you, and you wear your mask. So it is still, we're still going to, the good thing about COVID is that we know how to prevent it. We may not know how to treat it. And we're still looking at the vaccine, but we know how to prevent it. I think that is a massive leap forward, something we actually take for granted. And if we actually follow those prevention procedures, we can be almost 100% safe. And so it is more about following those procedures and explaining to people why they have to follow the procedure. So it's not just saying wear your mask. It is telling them that if you wear your mask, you will save the next person from perhaps illness and death. Can you imagine somebody thinking to themselves, they were the cause of that person's illness and death? I think we need to start to open up to these hard conversations. The fact that that next person, you could kill the person just because you are asymptomatic yourself and you are, spewing the virus all over the person. So it will persist with the talk. We will persist with the advice and the education. And as long as we all do it, every single stakeholder takes their part, even in this fight, I believe that we will get some success. And those low numbers that we're talking about could get even lower. I believe we stand a big chance, even in this part of the world, to have a almost coronavirus-free environment. But that is, making sure that everybody is involved in the prevention of this.
Dr. Koromade, anything to add to that?
Okay, so she has actually rightly said it. What we have to do is to keep reinforcing and keep saying the same thing. That's the only thing we can do. Nigerians need to take responsibility. That is our campaign, and we keep saying it all the time. Take responsibility to stay safe. Take responsibility to keep safe. Ensure that you wear your mask, especially in public settings. Make sure there is a distance of 2 meters to the next person, and avoid mass gathering as much as possible. Ensure that you wash your hand with water, running water and soap, and also use hand sanitizer. These are basic infection prevention control measures, actually. They are not only COVID specific. It will also prevent other infections, will prevent you from getting other infections, as well as we need to keep reinforcing to the people that the risk is still there. COVID is still with us, and you need to ensure that you take responsibility to protect yourself, protect your family, protect the entire country. And lastly, I would also like to also add that as we move into the festive period, if it's not exigent or if it's not really essential for us to travel, especially those that are in the Europe that are planning to come home or those that are planning to go over there, looking at the waves of events over there in terms of their second lockdown, in terms of their spikes and all that. I think we want to encourage all Nigerians to stay where you are. If it's not essential to travel, there is really no need to come home. This is the period where you can let go of our travel plans and ensure that we have a safe Christmas and have a safe holiday wherever we are. But if it's a must, you must come home. Remember that you have to do a COVID test where you are, and which has to be done 96 hours before departure. Upload it on the website and register to have a second test in Nigeria. And when you enter Nigeria, you'll be screened and you will not be allowed to go anywhere for the first 7 days after your arrival. So you look at it, does it really worth it? If you must really, if it's not compulsory for you to travel, our recommendation at NCDC at this period is please stay where you are and have a safe holiday. Thank you.
Alero, your last word on this, please.
Mine is going to go to the federal government. Let's make every effort to get the universities back on stream so that we can continue training the human resources for health that the government is going to need. And then everybody make a call on your political representative, your legislator, your House of Reps member, your senator. Ask why the health system in your immediate environment is not fully functional, staffed, and equipped. It is our right. It's our right to life. Let's enforce it. Thank you very much, Sister Alera. It's been lovely.
Thank you very much, Dr. Alera Roberts, consultant public health physician who joined us virtually, as well as Dr. Abby Abraham, a public health physician. She also joined us virtually. And Dr. Oyeladun Okunromade, Head International Health Regulations, NCDC, who joined us from our studio in Abuja. Thank you very much, all you three, for shedding more light on this for us this morning. Sunrise will return in just a moment with another interesting conversation. Do remain with us. Thank you for staying with us. Lagos, the commercial capital of Nigeria, has an estimated population of 14 million people. Commuting in the ever-busy city could be challenging because of its ever-increasing population, and this is all in spite of the transit system provided by the state. We have with us this morning, joining us virtually, Engineer Abimbola Akinyajo, who is the Managing Director, Lagos Metropolitan Area Transport Authority, Lamata. Good morning, Mrs. Akinyajo. Good morning.
Good morning.
Thank you for joining us this morning.
Thank you for having me.
Yes. You are the boss at Lamata. I would say that you have your work cut out, especially in light of what happened, well, should I say after the end-size protestation, or should I say during, well, you know what I'm talking about. The number of buses in Lagos has been depleted, and that must be causing you some sleepless nights.
Yes. We've been badly affected by the protests. A number of our buses have been burnt. A major terminal that we had just commissioned earlier in the year as part of the 1 year of Governor Sanwo-Olu's inauguration was also burnt, and it was but as you say, transportation is something that cannot afford to go to sleep, not in a city of 22 million people. So we're dusting up our boots and we're back on the road.
Yeah, so what plans do you have for the immediate? to help solve some of the transportation problems in Lagos? Because the population of Lagos, I mean, it's growing every single day. More people are coming into Lagos, and they need to move around somehow.
Okay. So when we look at Lagos, we see a teeming city of what, 22 million people. And we have about 12 million trips, public transport trips every day. And 97% of that is done on the roads. So you can imagine the reason we have traffic really is because everybody is on the road. So part of what we also see is the fact that our form of public transportation, even on the road, is hugely inefficient. We use mainly danfos, which will carry, 14, 15 passengers. So the plan of Lamata, obviously, first of all, we're sitting in a city that is, most of its public transportation is done by the informal sector. And what Lamata's role is, or what we've been trying to do, is to begin to migrate the informal to a formal sector. And also to move away from these small danfos. So when I say, for instance, a danfo will carry 14, 15 people, but a high capacity bus will carry about 70 people. So for every high capacity bus I put out, I take out 5 danfos, sort of technically, right? So the vision of Lamata is to end up with the majority of our bus transportation being high capacity buses. And in order to facilitate that, the state has about 500 high capacity buses that have been deployed, high and medium capacity buses that have been deployed, 500 to 550 buses. We have in total 800 buses that will be deployed. Some of them were burnt, unfortunately, in the protest. And beyond that, we're also talking to private sector. The vision of the state is to roll out what we call the bus reform initiative. And that is where the state sits back and implements all the infrastructure and allows or creates an enabling environment for private sector to work with us. And right now we have 5, we call them BOCs, bus operating companies, who are working with us. So for now, they're running the buses that we have put out, but the medium-term position is that they will bring their own buses. So as soon as middle of next year, say second quarter, third quarter of next year, and all of this has been pushed back purely because of COVID and all of the things that's been happening world over. But from round about end of second quarter, these private entities will also bring their buses. And so we expect to see additional buses come into the space of public transportation and hopefully reduce the challenges that the people in Lagos are seeing. So when I look at it from that perspective, we in Lamata, we are in the business of building infrastructure. So we're building bus terminals, bus depots, bus stops. We're rehabilitating roads to ensure that all of those buses will be able to do what they have been called upon to do efficiently. Also, part of what we're doing is to launch, which we did launch, the e-ticketing system that allows you to get on a bus or any form of transportation. That will also be extended to the water transportation and to the trains when they come using our Cowrie card. That also ensures effective and efficient onboarding of passengers. And it also speaks to safety. When you board the bus with your Cowrie card, you can identify where you are. We also in Lagos can also identify you. So when Governor speaks about we should not be anonymous in Lagos, owning a Cowrie card speaks to you being registered and you will get a card. And if you have any incident on the bus, on any of our buses, we can deal with it based on the fact that we have your details. So those are the sorts of plans we have in terms of transportation. Not to speak to our rail implementation that's coming up. The red line is on its way and it's due to complete end of 2022. That's a rail line that will travel from.
I'm sorry, Mrs. Akinyajo. Let's remain with the buses for now. We'll go to that other part in a bit. Now, how many buses do you actually have on the roads now after that incident, after the protestations?
So we have round about 400 buses, 400 to 450 buses. That's what we have on the roads. We still have a few that we can deploy, that we are fitting with all the electronic gadgets to ensure that they have the e-ticketing, the intelligent transport systems before we roll them out. But on the
Okay.
roads, as we speak, we have round about 400 buses.
400 of
400
how many? How many before the protests?
Before the protests, we had over 500.
Okay. Now, you spoke about e-tickets and stuff like that.
Yes.
Is it possible to get season tickets?
Right now, what is possible is that you can load your card to up to 20, 30,000 naira. So what it allows you to do is be able to budget for your transportation, and it becomes even more useful to you as we grow. So you can choose now. If I take the Abule Egba to Oshodi corridor, which has been successfully launched, and on that corridor there is no cash being used at all. So most people who travel on that, they actually would go to the either the terminal or on the Kauri app and load up to 20,000, and that's their monthly transportation sorted.
Is it cheaper for them if they buy in bulk that way?
What is definitely cheaper is traveling on the regulated system. When I look at Abule Egba Oshodi, for instance, our travel on that corridor on the BRT buses is 40% at least cheaper than the Danfos. What we will look at is when we are well established, we can then begin to look at giving incentives for people who do that journey regularly. So and those are things we're still working out. At this point in time, we're ramping up and we haven't got that system yet. But it's things we're looking at as to maybe you buy a certain number of tickets and you get one off or whatever. But we haven't worked that out completely yet.
Now, what I meant was if I bought, for instance, a single trip journey, as opposed to buying that 20,000 naira worth of trips, is it cheaper for me on the same route because I have bought in bulk? Would I pay the same thing as a person who's buying just one trip?
Well, what you're doing, you are not buying. So the position is whether you are paying a 20,000 naira or you are buying a single trip, you are still paying for a single trip. That is the system we have now. So Abule Egba to Oshodi, that whole stretch is a 300 naira ticket. And regardless of whether you've chosen to pay to load your card, because the card is yours, to load your card with more money than a single trip. What it's giving you is convenience. The fact that you don't have to go every time to go and queue to pay for your journey. For now, that's what we're offering. But over time, as we expand, we will look at that and see whether there can be incentives for those who load their cards for more money.
Okay. Now, the pressure on Lagos roads is something that everyone knows about. And sometimes when the traffic decides to deal with one can spend sometimes 4 or 5 hours getting from one point to the other. Like it happened on Thursday, from Lekki to the mainland, took me 4 hours, for instance. So with all that kind of pressure, what are the alternatives that you are planning to reduce the pressure on the roads?
The alternatives that the state is planning, obviously there's the waterways, which is already ongoing. There's also the train systems that we're looking at. What this administration has promised and is in process is the implementation of not just the blue line, which we intend to complete, but also the red line. So the blue line goes from, right now, we will travel from Mile 2 to Marina. And the red line will travel all the way from Agbado to Oyinbo for now, and then you can either hop on a bus, a BRT bus that will take you to Marina. So by 2022, those two lines will be operational. End of 2022, those two lines will be operational. If you think about Agbado to Oyinbo, you're looking at about anything from 700 to 750,000 passengers per day. If you look at the Okokomaiko end, which is the first phase of it, is what we're looking to come on stream from mile 2 to Marina, that will look to 300, 350,000 passengers per day. So from the state's perspective, we are actively and aggressively pursuing the implementation of the rail lines. We also put out the expression of interest for 4 other rail lines, and that was well responded to. And in the year 2021, we will begin to speak to prospective investors who have expressed interest in those lines. So there's the green line, which will go from Marina to Ajah in the first phase, and then from Ajah, once it's extended to Lekki Free Trade Zone, and the yellow line, which will be from Ota to Ido, the orange line from Ikorodu Agbowa to Ikeja, and the purple line, which is all, sort of like that Redeem Camp all the way to Lasso, and that will connect with the blue line. In addition to that, there is what I call it the Circle Line. It's the Victoria Island monorail that goes from Marina, travels round Victoria Island to Lekki, and then comes round through Ikoyi and gets back to Marina. That sort of connects my red and my blue that are coming into Marina with my green that's going from Lekki all the way into the Lekki corridor. So all of these things are part of what the Lagos master plan, the transport master plan that Lagos has, the implementation of these rail lines, the implementation of 24 water routes, which Lagos is systematically doing, and some of them have been opened, the implementation of dedicated bus routes, quality bus corridors, those sorts of things, so to entice people to come away from their cars and get into public transport. But beyond that, in implementing these public transport systems, we are also doing intermodal integrated systems, ensuring that when I come off my train, I can get onto a bus. So we have a system called the first and the last mile, which will take passengers closest to their destination. That is what will, so there'll be buses at the train stations, at the major BRT stations, and these are the small buses. This is where the small buses become useful, and they will take you from those major terminals closest to your homes. And with all this, when they come together, we hope, even if we have traffic, the most important thing is to have an alternative. So you choose to sit in traffic, that will be a choice you're making, not because you have to, because Lagos State will, by implementing all these modes and integrated systems, would have given you an alternative to using your car.
Yeah, I thought the red and blue lines were for delivery in 2020. You said 2022.
The red line is 2022 because we just started it. It was for implementation, start of implementation in 2020.
The blue line?
The blue line has been, that's the red line. The blue line has been in construction for a very long time. But this administration has ensured that we will, because the issue around a lot of these infrastructural developments is funding. So what we've done, what the administration's done now is to ring fence the funding for us and made it available. So the contractors now have given us programs, and we are all moving in that direction of making sure that implementation will be complete and operations will start end of 2022.
Okay. Now let's look at the waterways. Any plan for any expansion or the use of bigger vessels?
Now, bearing in mind, waterways is managed by LASWA, but I will speak to it from the perspective of the Transport Master Plan. The master plan speaks to an additional 24 waterways. And I think in the short term, there is a number of them that are earmarked to be put in place, or jetties are being built. And jetties, you can see that Pipe Cowries is very much alive and it's working. The one in Ijede, the one in Ibeshe. There is a lot of dredging taking place with the Ministry of Waterfront, and Lazwa Lag Ferry has bought, the state has actually procured 14 boats, and there's another additional number of boats that are coming on board. So the waterways is actually being expanded, and the different routes are increasing. And I believe that in 2021, they're looking to put in additional 5 routes. But, you know, that's, Lazwa is the owner of that jurisdiction. It's out of Lamata's jurisdiction.
Okay, Mrs. Akiajo, we will come back and continue this conversation in just a moment. Welcome back, and thank you for staying with us. We were talking about the waterways, even though I realized that it's under another agency, Mrs. Akiajo. But like you said, you're looking at it from the point of view of it being part of the general plan for the master plan for Lagos as a mega city. Yes, please go ahead.
So, like I said, there are new routes coming on board come 2021. The state is also looking to procuring more boats, but more importantly, they're also speaking to private sector to ensure that they come. So what the state has done, which is probably the same way we've done it with the buses, is to start by showing or demonstrating the viability of this business. So by buying the boats and putting them out there, and now speaking to private sector and ensuring that we have bigger boats, we have safer boats, and not just the local boat operators that we have. I know that very soon we will have more private sector input into the waterways as well.
Now, some people have said that Lagos has been growing for quite some time, and Lagos has been referred to as a mega city for a number of years. And the thinking is that Lagos State has not been proactive in planning to match the ratio of its population growth. How would you react to that?
Okay, I would say that I would disagree. And I would disagree, first of all, from the perspective that Lagos is probably the only state that not only has a master plan for the majority of the works, or the master plan has been, the Lagos Transport Master Plan has been in existence since, I don't know, 2000. And every so often we update it. So as we have it now, it is up to 2032. It's projected, the planning is projected to 2032. And this year, well, when I say this year, that'll be next year now, 2021, Lamata will actually update that one again. And that is what the state has been doing. And we have been growing. Unfortunately for Lagos, I guess Lagos's success is also its problem. We have a net migration into Lagos that is just huge. So from that perspective, our plans are constantly being updated to ensure that we match up with the level of migration we have. So from the position that not just our transport master plan is put in place, but we also have cities, areas like Koshofe, for instance, they have recently launched their own little master plan for the area. And what Lagos does is when all these local governments or local areas start to develop their master plan, it is sent around to all the agencies and all the other local government areas and LCDAs so that there is a synergy in the planning. And everybody understands that, well, if I do my road up to here, it's going to connect to another road in that local government area. And it's the same for the master plan for transportation, for instance. Even though I look after road transportation, I understand and I am aware of what it is that the water ways will do. And both of us have that responsibility to ensure that if Lagos wants to build an intermodal transport system, we have to have that level of synergy. So I know where all of his ferries will be, all of his jetties will be, and I have to ensure that I have buses that will relate to those particular areas. So I think in terms of planning, I don't know that there is any state that's done it any better than Lagos State.
Yeah, but no state has the kind of population that Lagos has, and Lagos has seen this coming a long time. And you said this all began in 2000. That's 20 years ago. By now, someone like me should be able to abandon my car and jump on a bus to wherever I'm going within Lagos, don't you think?
Well, yes. And I believe that from that perspective, we have, whilst you can say that we have the plans and we've been looking at it for the past 20 years, the developments in Lagos cannot be understated. There's no way you can look at it and say we haven't been doing part of the things that we have stated in our plan. I guess when you look at the areas of our bus implementation, we have built a number of bus stops, we have done a number of bus routes. In terms of working with our planning, we have a number of studies that has informed the bus routes that we have implemented. And as we speak, we must also be aware that all of this is sitting in the place of funding. But this particular government is determined to ensure that by the end of this administration, we will see a marked difference. Part of what we are also doing is ensuring that we move away from, as much as possible, from the informal sector to the formal sector. So in launching the bus reform initiative, we're liaising with the informal sector and we're dealing with them to bring them under the fold. Whilst you can't legislate against an existing business, you can gently bring them in the fold. So this administration is very, very much committed. And I believe when you look at it from all the things that we've been doing, is very much committed to ensuring that all of the planned infrastructural delivery will be done. And from the perspective of the rail, from the perspective of the buses, from the perspective of the infrastructure to ensure that the buses run. So we have, for instance, I have about 4 terminals that will come live next year. There's a terminal in Ojota, there's a terminal in Agege, there's a terminal in Aja that will come, there's a terminal in Yaba, and those ones integrate with the rail. So Lagos is going somewhere, and for definite, regardless of where we've come from, I can assure you that by the end of this administration, the transport system of Lagos will have seen a huge development.
Well, we can't wait to see that. Now, Caleb Daramola says, why are there so many buses grounded at the Ojota bus park and with no repairs in sight?
Ojota bus park. Now, this is, there are 2 ways to look at it. We have a private sector participant in the bus reform, and that is Primero. Those buses are Primero's buses. Now, there's some buses that we have, and what I said earlier was that some of those buses, we're putting validators on them, and we're putting intelligent transport systems on them to ensure that when my buses are moving, I can track them, I can ensure that the driver is behaving properly, and also people can use the e-ticketing system on them. And those are the ones I said that will come on board before the end of the year. All of the buses that we have will be on the road. There's some of those buses that belong to the private sector, and we're working with them to ensure that they bring them on board as well.
I have tried on 2 occasions and also yesterday to purchase a bus card at Abulegba, but each time I am told there are no cards available.
Abulegba, that's news to me. And what I would suggest because we have, he should, when he goes to Abulegba, he should dial the customer service number on the back of at the station. Somebody will attend to him. And if I could also get his number, I myself will probably call him and make sure that his card gets to him. So if you have a contact for him as he's called you, if you let me have it, I will deal with him.
Right.
But it's
Sorry?
No, I was just about to say that cards as of Friday, because I check that every day, cards are available at every station that they're being sold.
So let's look at the short term again. So there are fewer buses on the roads now because some buses have been burnt, obviously. So commuters are facing a hard time because we understand that Lagosians had taken a liking to those buses because they were so comfortable. And of course, the BRT lane also made their trips a little shorter. So there are fewer buses now. So commuters face a challenge moving from place to place. What's the short-term plan to reduce? We've seen long queues at bus stops for obvious reasons. So what are you doing in the short term to make this challenge a little more bearable for commuters?
So like I said, we had some buses that we were bringing deployment for later in the year. Those ones we're starting to deploy even quicker now, and that's what we're trying to do. I have at least another 150 buses that we're trying to put out, and that is what we have sort of improved or increased the rate at which the validators are being put on them, and we're hoping that in the next 2 to 3 weeks there will be an additional 100 buses put on the roads.
So there are more buses on the road, so we shouldn't have too many problems commuting within Lagos.
And we're also opening up new routes. What we're doing is we're trying to identify areas where we can extend our services. So whilst you see us in the Abule-Egba-Oshodi corridor, we're going towards Command, we're going in Ayobo direction. We also, that Oyingbo terminal was supposed to be serving Oyingbo to Idumota, Oyingbo to Oshodi, and Oyingbo to CMS. Unfortunately, we're where we are now, but we're looking for ways to at least start the Oyingbo to CMS route, CMS or Balinde route in the next couple of weeks as well. So we're opening new routes. We just have to keep moving, and that's what we're doing because the people of Lagos need to be moved.
So the blue line will come into commission in 2022, you said, am I correct? Sorry?
Yes, yes, it will. The blue line and the red line, both of them
blue
we're
and
looking
red,
at.
2022. Okay. So are we expecting that by at least 2022, Lagos will have taken the look, in quotes, of a mega city with these lines coming into commission, coupled with
Definitely.
huge number of buses which you also intend to deploy?
So if we look at where we're headed, for instance, like I said earlier, the buses that we have, they're the buses that are coming from the private sector. I'm expecting that come 2022, easily we should have 2,000 high, medium capacity buses on the road. Very easily, we would have about 2,000 last mile buses on the road. Also, as part of the infrastructural development, we would be building the Marina interchange, which will be an interchange that allows for water, BRT, rail, regular buses, and last mile buses. I will have that in Marina. I will have that in Mile 2. By the end of 2022, those two huge infrastructure will be implemented. We intend to start them next year. There will also be an additional 5 bus terminals that will also be opened. So there'll be Yano Ipaja, there'll be one in Abulegba, there's Ojota, there's Nako, there's one along Nako, there's one in Agege, there's also another one that we're building in Aja. So Lagos will look very different, and Lagos will begin to look like my strategic master plan says that we should look. A city that understands what it takes to move its huge population. Those terminals will allow people to go and take their public transport, either the buses, and most of our terminals, so for instance, Oshodi and Yaba and Oyibo, they are related to the red line. So if you come off the red line and go wherever you need to go. So there's intermodal systems. All of this is planned so that we have intermodal systems and connectivity between all of our transportation modes.
Okay. Thank you very much, Engineer Abimbola Akinjo, Managing Director, Lagos Metropolitan Area Transport Authority, Lamata. And good luck in the job that you are undertaking. Sunrise will be right back in a moment with another interesting conversation. Do join us. Ooh. Thank you for staying with us. We'll now be looking at the Farm for All project. Farm for All project is an initiative of the John Bosco Onunkwo Foundation in partnership with the African Entrepreneurs Foundation, and is geared towards giving smallholder farmers a new lease of better income through the provision of land and agricultural inputs. It's been researched that despite the billions on agriculture, food inflation has gone up by 108% since 2015. That's in 5 years. We believe that if we can get a sizable number of Nigerians to get into farming, as the Farm for All project signifies, we'll be going a long way to bridging some of these gaps. We have with us in the studio the founder of the John Bosco Onunkwo Foundation, Mr. John Bosco Onunkwo, who joined us from our studios in Abuja. Good morning.
Hello, yeah, good morning.
Thank you for joining us.
I'm the country rep for the foundation.
Oh, so this is Afam Okwone.
Yeah, our partners, John Bosco Onunkwo, is supposed to hook up from Anambra State.
Oh.
Via Zoom.
Okay, Mr. Okwone, thank you for joining us this morning. Now, why this foundation?
Get that?
Why this foundation? What makes farming so important?
Okay, I can barely hear you, but I think if you asked me about the project, you know, the Farm for All project is an initiative of the John Bosco Onunkwo Foundation. Now, it's totally geared towards creating awareness for Nigerian farmers. Right now, we're starting out from Anambra State, and as it is now, the founder, John Bosco Onunkwo himself, has put in about $50 million into the project in trying to get farmers in Anambra State across Nigeria in the long term to begin to understand the basics of what agriculture is all about. Now, if you understand there are different kind of funding in the agricultural sector. There's crowdfunding in the private sector, that is. There's crowdfunding, there's patient capital, and there's portfolio investment. What it's trying to do here is basically portfolio investment, which is long-term, but it goes to the extent of creating more value for farmers because you are patient. When you involve in portfolio investment, you're patient to a large extent. You know you're putting so much resources into these projects. You don't mind. You want to take your time and get the results. You want to get the benefits out of these. And the John Bosco Onuko Foundation is doing extremely well in that regard. And at African Entrepreneurs Foundation, we think it's necessary to ventilate what it's doing. And that's why the partnership is all about.
What exactly does the African Entrepreneurs Foundation do?
Okay, the African Entrepreneurs Foundation was founded. The founder is Mr. Joshua Wabo. Is a young Nigerian. We have a lot of ideas into which we try to put our ideas, into which we try to put our projects together, from education to health to agriculture. And what we basically try to do is to empower entrepreneurs. We try to bridge the gap between every sector of the economy, whether it's be education, whether it be healthcare, agriculture, like what we're presently trying to do. We try to bridge the gap between what people are trying to do in terms of entrepreneurs and trying to get resources. Because we know that entrepreneurs face a lot of challenges when it comes to financial resources, when it comes to capital. And we know that the only way they can be able to make ends meet is to get access to capital. And at the African Entrepreneurs Foundation, we try to go all out to source for means through which these entrepreneurs could get access to capital, to get access, not only capital, to training facilities also. So the African Entrepreneurs Foundation, our head office is in Ghana, but we're in Nigeria presently. I'm the country rep, and we're trying to see how we can be able to factor most of our projects in agriculture, because we see that agriculture is the way to go for now in Nigeria. That's why we're focusing on agriculture for now, presently.
The African Entrepreneurs Foundation was founded by a Nigerian. So might I ask why the headquarters is in Ghana?
Okay, well, I wish my founder was there to answer that. But because we're an African Entrepreneurs Foundation, we will not be able to have our offices in everywhere in the continent. But Ghana is a nice place. It's a neighboring country, and I'm in Nigeria. We're trying to make our work spread across the continent. Well, I wish it was here. We're able to say that clearly.
Okay. Where does the foundation get its funding from?
Okay, like I said, we have a lot of areas which we look at, from healthcare to education to agriculture, and because we try to bridge the gap between what entrepreneurs are trying to do in various sectors, we understand that there are a lot of well-meaning Nigerians who have capital, who want to invest, and we try to do our research. And when we do our research, we find out that there are a lot of Nigerians who want to also put money into projects, into entrepreneurs, into trying to build entrepreneurial capacity. And that's what led us to the John Bosco Onuko Foundation, to be able to identify him and say, okay, this is a Nigerian who is passionate about agriculture, who is passionate about food security in Nigeria, who is passionate about getting Nigerians to begin to understand the basics, the importance of agriculture in Nigeria. And so in such ways, when we go around, when we do our research, we're able to understand that some Nigerians want to get into projects, want to involve themselves into partnering small-scale entrepreneurs or large-scale entrepreneurs or medium-scale entrepreneurs. And when we're able to do that research, we get our facts right and we connect them together and trying to bridge that gap. So getting our funding just from individuals, presently for now, will mean well for different sectors of the economy in Nigeria.
Okay. We've been joined by the founder of the John Bosco Foundation, Mr. John Bosco Onunkwo, who joins us via Zoom. Good morning, Mr. Onunkwo. Mr. John Bosco Onunkwo, are you there? Farm for all, Mr. John Bosco. Okay, so Mr. Afam, does your foundation have any particular preference for sectors that you deal with?
No, if you say particular preference for sectors, our
Yes. Is
particular
agric,
preference
for
always
instance, a
stems from the
priority
facts
for you?
that
Is agric a priority for you?
Greek is a priority for us in Nigeria today, and our Greek is a priority for us. That's the basic truth. There's no saying the truism about what the agricultural sector is going through in Nigeria at this present. And I mean, with the advent of the COVID-19 pandemic, like what our partner, Mr. John Bosco Onukwo, said, the advent of the COVID-19 pandemic, and equally, not just the advent of the COVID-19 pandemic, we see the dwindling resources in Nigeria's oil and gas sector. So there's a need for us to focus on agriculture. Besides, the government is trying to close down the borders in terms of import of agricultural produce. And this is important. This is very, very important. I mean, the agricultural sector. And Engineer John Bosco Onukwo is someone whom we cannot take away that passion from. And it's a priority for us, it's a priority for him, and it's something that every Nigerian should key into the Farm for All project being launched by Engineer John Bosco Onukwo Foundation.
Mr. John Bosco Onukwo is finally ready. Good morning, Mr. John Bosco Onukwo, who is the founder of the John Bosco Foundation. Good morning to you.
Yeah, good morning. Can you hear me?
Thank you for joining us. Now, I just heard Mr. Afam refer to you as an engineer, but here you are, Farm for All. How did you find your way into this agric project? Can you hear me?
Yes, I heard when you said I'm an engineer. Yes, I'm an engineer. And you talked about Farm for All, but I didn't hear the question you asked me. Can you come back again?
I said you are an engineer and you're setting up a Farm for All project. How did you find your way into farming? Or how did you get involved in this Farm for All project?
Yes, I'm an engineer, but I believe in the principle of diversification as a survival strategy. Because when you consider the different dwindling economy and the situation of things, the survival strategy, the end thing now is for one to diversify. In as much as we have areas of our strength, it's also good to also identify some other areas of our strength to make sure that we make ends meet. So I believe in diversification, and I believe in diversification agenda of our president.
Okay. What is Farm for all about? I hear it's domiciled in Anambra State. Am I correct?
Yes, it's domiciled in Anambra State. What I'm trying, white collar is gradually phasing out. And what we are into now is a blue collar job. Farm for All is what I'm trying to do to sensitize our people, especially our youth, to make sure that they go into agriculture, to make sure that they identify the benefits of agriculture. Because previously people are seeing agriculture as a dirty job or a job that one cannot make ends meet. So we are trying to do Farm for All to make this sensitization and also to create the enabling environment, identify and understand the importance of agriculture.
Now, what exactly do you mean by smallholder?
Because a lot of us are looking out for white collar jobs.
What exactly do you mean by smallholder farmers? Are these commercial farmers or people who do farming just as a small business?
I can't hear you, but I can't get you very well.
Smallholder farmers, those are your target. What do you mean by smallholder farmers?
Those
Mr.
are my target, are the youths what I mean by the youth are there are many of our youth who do.
Mr. Anunko. Mr. Afam, how is your marriage with Project for All, your marriage, so to speak? How is your marriage going with Farm for All?
Okay, presently, if I got it correctly, you mean the marriage with the project in terms of Farm for All project. Okay, the marriage has been going very smoothly. In fact, to the extent that presently the financial target for Engineer John Bosco Onukwu, the foundation that is 50 million US dollars. It's putting into these small-scale older farmers and cooperatives also in Anambra State, not just to give them access to lands and seedlings, but to also give them access to training facilities. Because the truth is, most farmers, they say, okay, I want to become a startup farmer. But you see, like EPEPSA, there's an EPEPSA, I think it's in Ogun State. What they try to do is to allow you to learn. They create an avenue for you like IT. You come and learn for a period of 1 year or 2 years. You learn the basics. If it's fishery, livestock, or grains, whatever it is you want to go into, you try to learn it. And then at the end of it, you begin to practice it, you begin to go into processing. And that is important. That's important for what John Bosco is trying to do. Basically, to train farmers, and that's what our marriage, the marriage tries to synergize. The marriage is a synergy between training small-scale farmers through cooperatives, and giving them access to lands and even repayable and non-repayable grants. You must let that should be known. Non-repayable grants. They also get access to non-repayable grants. And the marriage has been going smoothly. And I need to give it up for Engineer John Bosco Onukwu. It's not an easy task. And we want to call on Nigerians across the country to also look at ways of investing into our young persons, into small scale, into small older farmers, to build a capacity. Because if everybody can begin to do this, it will go a long way into bridging the crippling effects that we currently have in the agricultural sector in Nigeria today.
John Bosco, tell us about the hectares of farmlands which you recently granted to some agric cooperatives in Anambra State.
Okay, the farm is located. First of all, the first one is in Awa in Orumba North local government, and that one is almost about 500 hectares. And the other one in Umuze in Orumba South local government, all in Anambra State, is another 500 hectares of land. And because of the good location of the land, agricultural land, we have the areas we have partitioned for cattle rearing, cattle, and want to go into local cattle, we already started their rice farming, because the land gets into the area that is good for rice farming, and also the snail and the fishery. And another important one is that we identified the special breed of cassava that grew within 8 months. We are also cultivating it, and also a special type of maize that we have also initiated. But the one that we are already started and we are harvesting is the one of is a cucumber that is really doing well in that area. So basically, I initiated it, I started it, I bought all these lands. And what I'm doing is to get in these youths, give them lands, and also make sure they go for training, like my partner is telling you, so that they can understand the basic rudiments that are involved. And why we kickstarted with this year is for us to prepare the ground so that this next planting season, from January, February, we will catapult it to the next level. They must have gone for training and come back, and they will all now specialize in different areas. The land and the neighboring environment are already provided, as you can see when we showed it in the previous telecast in the channels.
Yes, how did you get all this land that you're giving out to farmers?
First of all, I discovered this land in Awa. The Awa own is the first one I discovered. As I speak to you, they have a lot of land there. And the beauty of this land is that it's located very close to the third road, very, very close. So I had a discussion with them, and I decided to say if I can buy a reasonable number of it, and the other ones they can give me on leave. So the 500 plus was the one I bought. We negotiated, I bought, and I paid. That was before the COVID. And the other one, we now went into partnership on lease agreement because I promised them that I'm going into digital agriculture. And I promised them that this will bring development in their area. And also, most of their youths who aren't doing anything, we're also into agreement that I also give them this training. You know, they have a quota so that most of them can also benefit from the agriculture. It was in the point of we taking off from our own that I also have a friend who told me that Umunze is very close to my town. I'm from Umuchu. We have a common boundary. And the boundary between Umuchu and Umunze, there's a very big landmass of farm. I discovered another farm there, which is still open for sale. And I have to get in there, got another 300 plots, which I paid. And also the process, that 300 plus is where I'm doing my cucumber and the maize now, which you saw that we're already harvesting. Then the remaining plots, which is almost 1,800, we're already having also another type of agreement like we had in our, so that it will benefit the people and my own cooperative society, because I have quite up to 500 youths who are members of my cooperative society. And so that's basically how I got it. I can tell you there's enough lands. It's just for people to pick interest. When you get interest, you go into these interior villages, you see a lot of land. There are some, even all these old farmers who don't have enough energy to do their farm, they don't have resources. They are waiting for people who can buy their land or who can lease out their land so that the lands will be more productive for overall interest of our people.
Okay. Any plan for moving this project from Anambra to other states of the Federation?
Sure. You know, we first of all want to drink tea before we go to over tea. We want to make sure that we put this one very well. As I speak to you, I'm also discussing with my friend from Abia State. We want to basically concentrate in the southeast, because you can agree with me that in the northern part of the country, they know more about agriculture because they have this advantage about their land mass. So we'll have a partnership with my friend in Abia State. Already, one of my motivators is my friend from Ebonyi State. Ebonyi also have gone far in agriculture. So when we make sure we put this one, the motion on, the guy from I've forgotten the name, his town in Abia State, we have to kickstart his own. The Enugu State own is also waiting within the Soka axis. We'll discover a lot of large mass of Umudike area. They're also waiting. So I want to use it to integrate the Southeast, getting our youths, because the whole idea is for us to rededicate ourselves to rediscover our roots. You know, we want people to think back. I want our youth to think home. I want our youth to know that with what we have and with the enabling environment, that people can be gainfully employed on agriculture, food sufficiency. These are part of the reasons why I tell people get ready for the aftermath of this coronavirus, because the impact of coronavirus will be coming from the subsequent years. And if people like I've been creating this awareness will key in, I can assure you that hunger, at least we'll wipe out hunger, and a lot of our youth will be gainfully employed in agriculture, and it will divert their mind from a lot of social vices.
Very important, John Bosco. But how receptive have the youth been in those areas you're talking about?
Um, I I I use the strategy of our people, like, you have to bring them in, you have to give them soft landing. When you tell somebody, come, I'm giving you 3 plots of land, 10 plots of land free, and not just this land, I will also train you. I'm not just even training, and I will also give you, because also we're also making arrangement to buy most of these equipment, especially on rice, rice processing. We have an arrangement that we're bringing in some equipment for our rice processing. And after trading them, the land is their own. They have what they call tractors and all these things, which we will make sure we use to make them cultivate. It's just attractive. So what we are doing, and I can assure you, this COVID period made a lot of people to think back, made a lot of people to think home. When a man is hungry and is hungry, you tell him, come, let's do this. And you give him a neighboring environment, provide logistics. And my foundation has run for more than 10, 12 years. And I've been doing all this youth empowerment, youth awareness, capacity building to our youth. Because actually, my target is to make sure that these youths are engaged positively. So I use all those kind of strategies to bring them in. And once they come, they see even me leaving my oil and gas sector to also be practicing it, because everybody wants to see. I don't believe in theoretical. I believe in practical. They saw the land, they saw the cultivation, they saw everything, and there's an enabling environment. Is bringing them in. And when you get the positive youths engaged, the ones who tend to be negative must turn to positive. Is in present continuous tense.
You also organize markets for the produce for them.
Sure. You can even agree with me that there are markets for all this. The demands are so many. The rice, the cassava, the demands are so many. Once you bring out products like within that Orumba North and Orumba South, we have a big market in Umunze, and we even have another one just close to Ekulobia, that area. And do you even know another thing? I have 5 or 6 big trucks that can be able to transport most of these finished goods when they are harvested to different other areas. They can easily be marketed. So marketing is just a very easy thing once the products are all harvested. And once they're harvested, everybody that benefited from this, whatever you sell, the gain is entirely yours, so that it can now help you to cultivate more and more. So
when was your first harvest? When was your first harvest?
We're just doing the first harvest now. Like I told you, we started some months back. We're doing the first harvest on cucumber and the first harvest on maize. The cassava will still take a long time, because that one is about 8 months processing. And the rice, we're harvesting by end of middle of December towards end of December. That's when the rice will be ready for harvest.
Okay, when is the next planting season?
With the mechanized system of farming now, you can even cultivate things in dry season. Because of the irrigation, there are some of these crops that can now grow on a dry season, so far you irrigate them. But our next farming season is starting by end of January. There are some that will do well then, because we also have there's a stream that cut across my land, and we also have bought what do you call it, some of these equipment that will be good for irrigation. So as we are harvesting, we are starting the next planting season. But what we delay a little bit is the training. They will go for training in Cotonou for like 2 months and come back. But while they are there, our planting season will also be going on. So when they come, they key into the areas I apportioned all of them, and we hit the ground.
Is there any special reason why the training is in Cotonou?
That is to me, that is the best place we have a training ground for. But yesterday, I had that school in Cotonou. They have an affiliate with somewhere Federal University of Agriculture in Umudike. I heard about it. In fact, as I speak to you after this interview, I'm going to Enugu now to have a physical inspection of the facility and get on the spot assessment. So if we can, if what I heard is true, it will save a lot of cost. Then we'll go to Ubudike there to do the training instead of going to Cotonou. That will cost a lot of money.
Lekon Yusuf says something here, but it seems that he has misunderstood everything we have said. Please be careful with any investment funds seeking program you push out. Remember, whole corn, they advertised and people invested en masse. Unfortunately, all those who invested are regretting it. But you are not asking for anybody to invest. You've set up a foundation and you are the one offering people training, offering them land, offering them siblings and everything. Am I correct?
Yes, very correct. I agree with you because a lot of 419s are there. I'm just trying to be very careful in terms of that because what I've been doing previously is on my own, within the foundation capacity. So whenever I'm assessing this thing, I need to be extremely careful to check the pros and the cons and be sure that I get the one that is very, very legitimate.
At the end of the day, Mr. John Bosco, what's in it for you? At the end of the day, what's in it for you? John Bosco?
The network is breaking. I can hear you again.
I said at the end of the day, what's in it for you? You can't hear me? Oh, all right then. Mr. Afam, what's your last word on all of this? I mean, the good work that John Bosco is doing, getting land for people, training them how to farm, teaching them everything they need, even providing transportation to take their produce to the market.
Okay, our last word is the fact that by November 2021, that's next year, the project is expected to meet the Millennium Investment Goals of the United Nations. And the Millennium Investment Goals, part of them is set on food security, eradication of hunger, the crippling food prices, in terms of try to cripple food prices, creation of employment, and means of livelihood for the local populace. So my last word is that John Bosco Onuko has taken the right step through his foundation, trying to empower Nigerians who are needing to make ends meet for themselves, who are needing to become self-employed, who are needing to become entrepreneurs in their own capacity. And it's something that I think most Nigerians should begin to look at, most Nigerians who have the capacity just like him. Because the truth is, the government alone cannot do all of these. We are aware of the rising food prices in Nigeria, which is, of course, due to the climate change. Most of our family in Nigeria is rain-fed and not irrigation-fed. We also understand the issues of insecurity, which has also led to the rising food prices. The shutting down of the borders also has also led to rising food prices because to a large extent, we have a lot of population in Nigeria and we do not have the capacity to produce food to meet our population. And if such projects, Farm for All projects, is being initiated by several other well-meaning Nigerians who have this capacity to do this, it will create to a large extent, give Nigerians a breathing space. And we can be able to say, okay, yes, we are on the map, we're on the road to ensuring food security in Nigeria. John Bosco Onuko Foundation is doing all of this, and we intend to do more of such projects with this foundation, and is awesome, is sublime.
So, Afam, how much is this going to affect food prices and how much is it going to affect food security in Nigeria? You answer all these after this break. Welcome back, and thank you for staying with us. Afam, back to you. How much do you think this initiative is going to help food security?
Okay, yeah, before the break, you also said how it's going to affect food price, how it's going to help with food pricing
Food prices,
and
yes.
food security. Yes, the truth is, you know, like if you listen to Engineer John Bosco clearly, he said he's getting these lands and he's also engaging people within the communities to farm on these lands. And presently, like we got some reports in Nigeria that some farmers are not able to go to their lands to farm because of banditry, you know, and it's affecting food production in Nigeria, and that to a large extent or to some extent creates a large, a rise in food prices. But with this project, you don't have to go to a long distance to farm. The farm is within your locality. You just wake up in the morning, you go to your farm, you till the ground, you yield your crops, you produce your harvests, and we're able to see that through such initiatives, there will be a large inflow of agricultural produce into our markets in the southeast, and then it also creates, to a large extent, the availability of foodstuffs in the market, and that can also create food security for Nigeria because we need to farm, we need to produce our own food in Nigeria. Is important. It's important because we cannot underestimate the fact that the federal government shutting down our borders to a large extent is a blessing in disguise. It's tough. It's tough. It's tough for a lot of for a lot of Nigerians, but in the long term, it's going to pay off. And this is a project, as it stands, with the vision, with the mindset of the founder, with the mindset of the founder. This is a project that has the capacity to create more agricultural produce in our markets in Nigeria. And in so doing, we can rest assured to an extent that food security will be taken care of.
Right. Back to you, Mr. John Bosco. Are you there? Mr. Anunkwo?
Yes, I'm there.
John, okay, you're there. Now, Jide Buraimo tweets, it's a good and generous program. What's in it for you, Mr. John Bosco? Hear me? Mr. Anunkwo, did you hear me? Jide Buraimo says it's a good and generous program, but what is in it for you, Mr. John Bosco?
Okay. The most important thing is the result. As a humanitarian, I'm a philanthropist, I'm a humanitarian, I'm a Rotarian. I believe in service above self. I believe in service to humanity. I believe in putting smiles on the face of the people. I'm a core Rotarian, whatever you do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? And above all, will it be beneficial to all? So far, this can put smiles on people. So far, it's beneficial to the youth. And so far, it will bring food to the table. The youth bringing food to the table, their parents will enjoy, and hunger will be reduced, if not drive away. I mean, I'm fulfilled. I'm a totally fulfilled man. So that's my vision, to make sure that I contribute my quota to render service to humanity.
Okay. That is very stoic indeed, Mr. John Bosco Onunkwo. Thank you very much. You are the founder of the John Bosco Onunkwo Foundation. And we also had Mr. Afam Okone, who's the country rep, African Entrepreneurs Foundation, who are partners with the John Bosco Foundation in this project for Farm for All project. Farm for All project. Yes. Thank you very much, and we only wish you good luck and God bless the work of your hands. Thank you very much for joining us. And that wraps up.
Thank you so much. Thank you.
And that wraps up Sunrise for this day, the 21st of November, 2020. Thank you very much for staying with us. We hope you enjoyed being with us. and we'll bring you a fresh edition next Saturday. In the meantime, be the best that you can be, and remember, in this Christmas period, show love to someone. Many, many have been affected by the COVID-19, and many have been affected by the NSAS protests, who all just need someone to tell them a good word to make their day. Be that person who will make someone's day. Thank you very much. My name is Alero Edu. See you next week.